Hi, Assalamualaikum and very good day. My name is Haliza binti Rifin and I'm the first author of a paper entitled Knowledge, Perception and Practice of Infection Control among Ministry of Health Staff during COVID-19 Outbreak in Malaysia. I would like to present the content of the paper, which has been published in International Journal of Public Health Research in March 2021. I will start off with the introduction. Coronavirus disease or COVID-19 was first reported in Wuhan, China in December 2019. And in Malaysia, the first case was reported on 24th January 2020. COVID-19 then was declared as a pandemic on 11 March 2020 by World Health Organization. And the Movement Control Order in Malaysia was introduced on 18 March 2020. At the time when the study was conducted, there were no vaccine or treatment available. Thus, good hygiene and other public health measures were essential to prevent and control the disease. It is important that healthcare staff have correct knowledge, perception, and practice of preventive measures of COVID-19. A well-informed healthcare staff will be not only able to protect themselves, but also able to provide optimal care and facilitate in educating the public regarding disease preventive measures. Thus, the objective of this study is, the first one is to determine the knowledge of COVID-19, and the second is to determine the practice of preventive measure of COVID-19, and the last is to determine the perception of effectiveness of these preventive measures among MOH staff in Malaysia. For the methodology, this is a cross-sectional study which was conducted from 30th March 2020 to 6 April 2020 among MOH staff using online survey Google Form platform. The universal sampling was used in this study, whereby all MOH staff with official email address were invited to join the survey via email from MOH Malaysia Postmaster. We also utilized several strategies to reach many respondents as possible, including MOH portal and also WhatsApp. The face validity of the questionnaire was tested prior to the survey, and informed consent was obtained prior to the survey. And this study was approved by the Medical Research Ethics Committee, Ministry of Health Malaysia. For study instrument, it has 4 sections. The first section is the social demographics, followed by knowledge, which consists of 13 items of yes or no options, followed by practice section, which consists of 23 items of yes or no options, and lastly is the perception section, which consists of 23 items in the form of 5-point Likert scale. So this is table 1, which shows the social demographic characteristic of the respondent of MOH staff. A total of 1,719 staff completed the questionnaire. The respondent consists from all 16 states and federal territories. The mean age of the respondent was 36 years, ranging from 22 to 59 years of age. The majority of the respondents were females and Malay. Here, proceed with the knowledge on COVID-19. If you see in figure 1, more than half of the respondents between 66.1 to 68.9 were able to identify fever, cough, and shortness of breath as the main symptom of COVID-19. A total of 65.3% identified all 3 symptoms as main symptoms for COVID-19. We proceed with figure 2 and figure 3. The respondents were generally had a good knowledge of the disease. For each item, a total of 92.3 to 99.8 of the respondents answered correctly to the question, with a total of 86.4% of the respondents answering correctly to all 4 questions on knowledge of COVID-19. Similarly, in figure 3, a total of 86.7% to 99.1% of the respondents answered correctly on the transmission of COVID-19, with 83.4% of respondents answering correctly to all 4 questions on COVID-19 transmission. So, in table 2, respondents were asked on each preventive measure they are practicing against COVID-19. Over 90% of the respondents reported practicing most of the preventive measure, except for using hand sanitizer at public places, using hand sanitizer and wearing masks at public places, in which they were reported only by 89.9%, 89.0% and 88.8% of respondents respectively. This was similar to the findings of their perception of the preventive measure effectiveness, whereby most of the items scored more than 80% by the respondent, except using hand sanitizer at public places and wearing masks at public places, in which reported only by 76.4% and 77.8% respectively. A total of 7.1% of the respondents did not practice any preventive measure. For Table 3, the respondents of the survey were asked a hypothetical question of the action they would practice should they have any symptom of COVID-19. Most of the respondents answered positively to the statement provided, ranging between 89.8% to 99.7%. Wearing masks at all times had the lowest response at 89.8%. Meanwhile, washing hands regularly with soap and keeping a 1 meter physical distancing had the highest responses with 99.7% and 99.5% respectively. For the finding of their perception of the preventive measure effectiveness, should they have any symptoms of COVID-19, most of items scored more than 90% by the respondent, except for throwing used tissue and mask in bin, which was reported by 85.5%. For discussion, only a moderate number of respondents had good knowledge of COVID-19 symptoms. This was due to the changes in MOH guidelines and case definition on COVID-19. Inaccurate information being disseminated via social media from unreliable resources may also have caused confusion to the staff. Although MOH staff reported a lower percentage of correct answers on COVID-19 symptoms, they had better knowledge of the disease and transmission of the disease, which showed that information on the disease was being delivered effectively to MOH staff. The least practiced preventive measure by MOH staff were wearing masks at public places and use of public hand sanitizer. The reason behind of least practice of wearing masks at public places was due to accordance with WHO guidelines at the time of the survey, whereby only those with symptoms were encouraged to wear masks. Majority of the MOH staff reported positively to practice measure and perception on preventive measure effectiveness should they develop symptoms of COVID-19. However, there were gaps observed between the practices and perception of its effectiveness. When there is a gap between perception and practice, it is feared that the practice of the preventive measure will decrease with time or as cases reduces. This gap should be tackled with targeted and specific health messages so that the importance of these practices are well understood and will continue to be practiced in future. In conclusion, the symptoms and information regarding COVID-19 need to be clearly communicated to avoid confusion. The gaps between the practices and perception of their effectiveness should be tackled with targeted and specific health messages. These messages must not only be instructive but also be accompanied with clear reasoning to educate the staff of is important. This measure will become a new norm in future, even when the threat of COVID-19 is low. So here are the references. With that, thank you very much.